The weekend. Thank you. Well, the pandemic put elective surgeries on hold. However, a Scripps orthopedic surgeon used that time as an opportunity. She used her downtime from the OR to refine an innovative new hip replacement technique, which she recently introduced here in San Diego. And joining us now to talk more about this is Dr. Anna Coolidges. Welcome, doctor. Great to talk with you.
Thank you for having me, Ginger.
Well, thank you for being an overachiever and not resting on your laurels and taking a break, and instead you're just starting to redefine surgery. So let's talk about it. COVID hits, and then you discover a major improvement to hip replacement surgery. How did this happen?
I was probably fortunate, and the timing worked out great because I was in an international conference for sort of innovative techniques and met this surgeon who just finished introducing this through Europe. It's another way of doing an anterior hip replacement, which, as you know, has been popularized here in the U.S., and we're achieving really good results. We relied heavily on a table to help us position the patient so we can get to the bones to replace the hip, or had these special big retractors. He basically came up with this idea that you can suspend the retractors and allow the soft tissues to move along with the surgery. And with this as well, he didn't really need any assistance. So you moved all of the assistance, so that chance of accidental moving of the tissue by assistant disappeared. And also he didn't need to put the patient through the various motions that the table type anterior hip replacement does. And so this was a great way, just another addition to make hip replacements even better. And with this technique, he also shortened the procedure, where it really can be offered to pretty much any patient of any physical activity level, size, and achieve results probably within an hour, just under an hour. So it was a very good timing for me to bring it and be able to work out the kinks and work in a cadaver lab and with my partners to make it even better.
I was just going to ask you that. How do you work out the kinks when you're exploring a whole new technique for surgery?
So he has his technique, which is called EASY, EDA, standing for efficient surgeries. Amazing in a sense that it has specific steps and very, very safe steps that he worked out in a cadaver lab when he developed this technique several years back. And we brought those same retractors and same techniques. It's really just a suspension. So the idea was for the surgeon to place the retractor in the safest possible spot and that nothing moves after that. So working that in a cadaver, that was really the best way for us to know how to do it the gentlest possible way to improve the recovery, to speed up the techniques that we're used to, and also to make it more safe in terms of placement of these retractors.
So now you just introduced this here in San Diego, this new technique. What has the response been from your colleagues?
So I was very fortunate that a couple of the colleagues from a great group that I work with, I work in Scripps Green, and it's one of the top 10 countries orthopedic group. They were very, very supportive, and they came into the cadaver lab, and so we together really worked on this. And my junior partner, Dr. Jeff Wilde, who is a phenomenal young surgeon, he's also doing it. And we're both very excited because our patients are coming back basically at the 2-week mark asking, when can we do the next sport? Or if they need 2 hips, can we do 2 of the hips together? It's been a very, very encouraging turn of events where we're all a little bit down, obviously, through this very challenging time, but to see our patients smile is a phenomenal turn of events for us, and we're very excited to offer this.
Yeah, as far as the perfect candidate, do you have to fit into one kind of structure, one kind of age group, or is this a procedure that can really, go across the gamut?
I think that was the most exciting part when we offered anterior techniques before, because it's very challenging to get to the hip itself, to the bone itself. We had to fit the skinniest, the fittest, and it was very hard to offer it to people who are slightly maybe shorter, slightly on a bigger side. So these retractors are truly revolutionizing our ability to offer it to the widest audience. And obviously the age was never really an issue with any of the approaches. So I think this is a big change for us.
Big change for a lot of folks as well, all the patients. This is exciting stuff. I've been reading all the reviews, and, just to hear what patients are saying 2 weeks after this procedure and being so mobile is just amazing. So, Dr. Coolidges, and thank you so much for joining us and for, not taking any time off during COVID.
Thank you so much for having me and for helping let people know that there is hope, and we're open and we're happy to help them.
Happy to do that. All right. Thank you.
Thank you.